Samantha Lederman was a new college grad with her first so-called adult job in event management. The pandemic stripped that away. Mental health issues she'd struggled with for years became worse.
It's been way too long since, I have been able to go and sit in the cafe and just have a positive atmosphere, or get away from home, or get away from the environment that could be causing me anxiety or causing me to be irritated or depressed because it's the same four walls.
She's had some virtual support through a young adult mental health center, Stella's Place, which she credits with saving her life. But now, in the third wave, she can't wait longer for in-person help.
I sound very strong, but definitely, like I said, there becomes a time where my anxiety and my depression is going to overtake me.
According to new Ipsos polling, Lederman falls into all four of the hardest hit categories for mental health: women, younger people, low-income Canadians, and people living in Ontario, Alberta, or the Atlantic.
We're kind of taking the fact that our plans didn't work out as much really hard.
On the whole, the number of Canadians facing mental health challenges continues to climb. Half of those surveyed deemed at high risk, up from 33% when tracking began in 2015. But the survey also found more Canadians are now willing to talk about it, 53%, with friends, a healthcare provider, or by posting on social media.
I think because so many of us are impacted by it, it is a lot easier to respond honestly about what we're experiencing, the stress and the impact on our well-being.
Experts are still seeing increases in appointments and warn the impacts could be long-lasting.
There's generally a tendency to think that things will get better, and it's usually once we can let our guard down post having to be in survival mode that we see a lot of stuff come up for us.
As for Lederman, she's launched a side business as she looks for work.
It is 150% just as important as talking about a vaccine, talking about a third wave.
And she's going to keep talking about mental health. Abigail Bimman, Global News, Ottawa.